This podcast is sponsored by Orchid Live. Find out more at orchidlive.com.
So a big welcome to everybody for this roundtable discussion on the future of occupational health. My name is Amy McKeown. Now, as many of you know, all of you hopefully know, it was the Society of Occupational Medicine's 90th anniversary last year. And the discussion that we had throughout the year was, what does the future of occupational health look like? We've had a few blogs and webinars on that. So we thought we would follow this up by this special session where we have a broad range of highly experienced and senior people to sit and have a discussion about that.
Hi everyone, I'm Dr. Charles Goss, consultant occupational physician and head of service in the NHS occupational health sphere, but I also chair the NHS Health at Work Network, which is the membership organisation representing NHS occupational health services.
Hello, I'm Alasdair. I'm a consultant occupational physician and I'm the head of health of Health Partners Group.
Hi, I'm Professor Neil Greenberg. I'm a consultant occupational psychiatrist and currently I'm the president of the Society of Occupational Medicine.
Professor Kevin Bampton. I'm the Chief Executive Officer of the British Occupational Hygiene Society, but I'm also the Chair for the Council for Work and Health that brings together around 40 organisations to advocate for work and health issues within the policy sphere.
I'm Rachel Surf and I work in the public policy team at the CIPD, which is the professional body for HR, people development.
And also really relevant with, obviously, and I'm sure it'll come out, what's happening with Keep Britain Working and how occupational health fits in with that. So you can see it's going to be a really rich and broad discussion with this one. So Neil, I'm going to start with you. What do you say about the future of occupational health? Where do you think it might need to modernise, or is it good as it is?
Thanks very much, Amy. So I'll leave the details of occupational health practice to Charles and Alasdair, considering that that's what they do. But what I will say is from the society's point of view, where we see our value and where we see occupational health going is to try and make sure that organisations use it properly, getting organisations to get advice from or refer to occupational health early on, because one of the challenges is however fantastic an occupational health professional you are, if you get someone 4 months after the problem started and it's entrenched, it's incredibly difficult to fix. So we want to get people who are going to refer to management referrals to come in early, even if sometimes that's only about getting advice rather than actually seeing patients. So that's one thing. The second thing is we really want occupational health professionals to be part of an organisation's strategic direction, because if an organisation is interested in their staff, they're going to want to make sure they're healthy. And of course, they've got occupational health professionals as part of their organisation. So even if they're not going to sit on the board, which I think would be lovely if they would, they should absolutely be advising the board about strategic directions in terms of workplace health. And I think the last thing, and it kind of touches on what you asked, is the interplay between well-being and health. And I think this is a potentially complex area, is the society is setting up a quality mark for organisations that provide well-being services. The well-being space out there with mindfulnesses and yogas and all these other interesting interventions, it's a busy area. At times it's been described a bit like the Wild West. And so what we really want is to try and bring an element of standard setting and similarity. The very last point I'll touch on, the OH workforce needs to be good for the tasks ahead of it. So we're setting up a competency development program so that those diplomates can build up their skills and their competency so they can add usefully to the whole of OH practice.
What about the future of occupational health as a specialty? Should we need to change what occupational health delivers as a specialty to adapt to workplace issue as well?
I think in short, and it might sound dinosaur-like, no, it's really clear that organisations need healthy workforces so that they are productive and also that they meet their legal obligations and they attract good staff. So I think occupational health professionals are right at the heart of that. And one of the things I think many of us in OH kind of scratch our head about is we know what we deliver is good and useful and helps organisations do well. It's just difficult to understand sometimes why organisations won't take that up. You know, if I said to an organisation, do you want to improve your productivity by 10%? I'm sure most of them would say yes. I think we should not just keep doing the same. We need to modernise. We need to use different, AI and new diagnostic techniques and use new approaches, new evidence. But the basic core of keeping people healthy at work and optimizing their ability to deliver well, I think that those are core OH skills, and they should continue.
Thank you. Charles, you were vigorously nodding during most of that.
Thanks, Amy. Very kind. Occupational health was left out of the NHS back in 1948. It has never been properly, in my view, legislated for under the umbrella of health and safety. And that means to this day, it is still widely misunderstood. But you can't have a successful working relationship with your employer if they don't really understand what occupational health is. And so if you're inviting occupational health in to have discussions by the time someone has already become unwell, you've missed the whole point of what we're supposed to be achieving. Occupational health needs to take an opportunity to reposition itself as being a key stakeholder in workforce sustainability, supporting managers earlier on, using data intelligently, getting in there at board level and at whatever strategic level we need to think about, particularly in the NHS setting. And we can't have a happy, healthy working relationship between occupational health and all those other key stakeholders unless we really get that representation at board that we need and we have absolute clarity of understanding and purpose.
You mentioned the word, and the reason we're all here today is to talk about the future, modernisation. What do you see modernisation being?
Well, we're stuck in a medical model, aren't we? I think that's the first thing to say is as occupational health professionals, a lot of us are from a medical and nursing background. But the adage is not everybody with a headache needs to see a neurologist, but some people do. And we have our role as qualified occupational health professionals.
Rachel, from where you sit within the workplace, what would you like to see out of a sort of evolving specialty?
The potential for occupational health to really change society and the quality of people's lives beyond their working life is enormous. And I'm thinking about occupational health in its broadest sense. Yes, occupational medicine, occupational health as a specialty within that, but I'm thinking of occupational health in the sense of the health of the working age population. And I think the Keep Britain Working Review has, first of all, really shone a light on what the missed opportunity, an opportunity there still is in terms of improving health amongst working age people. But it has also, I think, served to galvanise people in this space to make a difference. But I think we've got to bring it down. If we're going to think about the difference it's going to make in society, occupational health to people's lives, and I think we've got to think about, well, what does that at an individual, at a community level? And then I think it becomes more real when we start to think about it in terms of the 3 million that aren't in work because of ill health. Not all those want to work or can work, but there are definitely, a couple of million who would really like to work, not just because of the financial reward, obviously very important, and the impact that can have in communities and society is obviously tremendous, but also the meaning and social connection and purpose that work can bring to people's lives. And I think it becomes even more real when within that section of society we think about what is happening with our young people today, their ability to access work even in the first place, and the worrying disproportionate reported level of mental ill health amongst that group. This is literally our future. So if we're going to talk about the future of occupational health in society, then we've got to think about our young people. And then if we just turn our thoughts to those already in work and what a difference it could make to those already in work, but who are contemplating leaving work or have already left work due to a lack of support, effective occupational health in its broader sense, because obviously we know that many people don't have access to occupational health as a clinical service, and some do very much need it, of course. So I think nothing shines a light on that, as well as perhaps the situation we've got with women's and reproductive health at work. At the CIPD, we've carried out a number of different research studies among people with lived experience of health issues such as menopause, menstrual health, fertility challenges, pregnancy, baby loss, and it has really hit home what a lack of support in terms of health support can mean to someone's career, ability to carry on working. It's really stark, and just also the kind of heartbreaking stories that you get back in that box where you say any other comments. And I mean, just really heartbreaking, some of the stories that people talk about in terms of not being able to participate in work anymore and having to step back. And what's also come through in our research without fail across so many different areas of health is the difference it makes to people at work if they do have a supportive employer that will provide that specialist occupational health support where needed. But we also need line managers who are competent and skilled and know how to discuss and implement effective adjustments and so on. But there's the cultural piece as well. I think it's very important that occupational health, if it's going to make that real change in society and have that impact, it has to be really holistic and provide support in a preventative sense, but also for people as they experience different health and well-being challenges through the life course, because we can all experience those at certain stages or at any stage as well. I'm thinking bereavement, suicide risk.
What you've said, which I think, the future for you is holistic occupational health, preventative, providing different support across the life course for different needs. And I think that's a really good kind of summary for the future. Really, like if we can build occupational health that does that, then we've done it. Alasdair, we've seen change in the occupational health private sector in the last few years, but most provision, especially since the Medigold sale, is two big providers. Where do you see in this broader conversation about the future of occupational health and how we can broaden out the role of a private provider in that?
I think you're absolutely right. What we're seeing is consolidation of the marketplace at the moment. Procurement has changed everything. In the old days, we would sell to HR directors, chief financial officers, CEOs, and they bought what they thought in discussion and collaboration was the right thing for their businesses. We are now procured like computers, motor vehicles, other services. And that intelligence of procurement is very different. I do see clients as being the main drivers of change here, over and above everything else that government is doing or not doing. I think employers want a single supplier. They want a single data set. They want that data interpreted intelligently so that they can tell the health of the nation, their nation, because the marketplace is very competitive. They want to know how they compare against their peers and how they can be better. And when I say better, they do acknowledge having a healthy, stable, engaged workforce will, providing all other things are equal, deliver higher profitability to shareholders. We have to be very clear what it is that we're doing, where we add value. I think there will always be clinical need. But of course, what we do see is, as we age, an increasing burden of ill health and people living with multiple health risk factors. And that does need clinical input in order to optimize that. So I think the model is one of a single provider. We call ourselves a corporate healthcare solutions business. I think occupational medicine is the fundamental heartbeat of that, but we are a healthcare solutions provider. So those are my general thoughts in terms of what the marketplace will look like over the next few years. With AI is an integral part of it. It's a threat and a massive opportunity for us. I think we need to have much clearer engagement with the NHS in terms of treatment, workers who contribute to the economy. There should be care pathways for the things that they need using the NHS so that they can return to work. Obviously, some organisations, get fed up with that and they move to funding that privately, but not everybody, and certainly in the SME market, that really doesn't exist. And we need to cascade what we do well into the 50% of workers in the UK who have no access to OH at all by providing, the right services at the right price that's deliverable and easy to access. I think the future is bright, and I'm going to stop there. There's lots to do, but I think the future is bright.
Kevin, I have you down to talk about, your thoughts about this, but also, especially if we're looking at other models from the pure medical one, what that might present for regulators.
Currently, Keep Britain Working is, it's as much a symptom of regulator frustration as anything. Just basically, there is this kind of governmental frustration, which has been expressed to me in a very simple terms. If you've got 1.8 million people who are being made ill through work, 1.9 who can't work, then what on earth has gone wrong with occupational health? What we will see is the continued battle between Department of Work and Pensions, HSC, and Department of Business and Trade, trying to square the circle about how you get people working but don't break them even more before returning them to the NHS. So the sustainability that Charles talks about is right at the core of this. Our challenge, if you like, as professionals, is to maintain those professional standards, not lose the link with the clinical leadership to make sure what we don't end up with is bypassing clinical standards, but also that big education piece about what is it that workplaces need to know and understand to be intelligent consumers. We need to make it a lot easier to understand what occupational health professions provide, what the value is, how that works, and to sort of try and have a bit more collective influence on the market, because otherwise the market will be just driven by what people think they need, what people will see is the most instrumentally valuable or the most fashionable, and fashion is very, very strong. This is why SOM's intervention in terms of helping to guide the well-being industry is really, really important. Just because it sounds good and everybody loves it doesn't mean it's your wisest use of resources, an impacting thing. And the final thing, and it's great that Alasdair's here, the integration between sort of true primary prevention, what we call occupational hygiene, so getting the workplace to be a healthy environment, and then primary prevention in terms of that early intervention diagnosis. That's really important, that wraparound product which goes into the process, the environment within which people are working, not just dealing with it as an on-demand service once your HR function has identified there's a problem.
I mean, I've spent a lot of time either procuring or helping to procure not just occupational health, but other well-being type products. The challenge is that you've often got HR trying to procure occupational health and the benefits and reward team procuring other ones. Management of those providers split elsewhere, and my experiences is zero clinical knowledge in an organisation. So people are muddling through with procurement and benefits, and the conversation becomes about excesses and how much a report costs, not the clinical value. So no, really helpful. Charles?
Yeah, thanks, Amy. My hope really is for the future of occupational health that we're going to see it delivered in a broader way, not narrower. Still going to have a clinical focus, and clinical credibility has got to be retained. We've got that multidisciplinary aspect that we've talked about. It's got to have better digital support and be closer to the realities of work. I mean, in the NHS, we need to see this being treated as a core workforce infrastructure problem, so that the NHS staff who are happy, healthy and better able to do their jobs deliver better care, they can address the waiting lists and they can do their job that they need to so importantly do. And across society, it means from an employment perspective, we need to move away from this culture of certifying absence and then saying goodbye to people from the workforce, and moving to designing a system that enables workforce participation throughout the working life cycle, like Rachel said.
I think that's a brilliant sentence, designing a system across the workforce participation across the life cycle. Brilliant. Thank you. Kevin, a sentence, please.
From the OH perspective, we need to be thinking in a more business-like way, in the sense that the employer doesn't want a set of complex products that they've got to knit together. They just want to have a service which enables them to operate effectively and well so their teams can do the job. Whether it's single provider or a network of people who work together so that the end point is easy for the employer to deal with. They don't have to buy multiple different services.
Neil?
At this moment in time, it's pretty obvious that our government is extraordinarily keen to keep people working and get them back to work. The solution lies with occupational health. We all know that. And so we need to bang that drum, provide better evidence to make our message clear. And I agree with Alasdair, the future is certainly bright.
This podcast is sponsored by Orchid Live. Orchid Live is a specialist occupational health software used by a number of SOM members to run every aspect of their occupational health operations. They hold healthcare records for over 1 million UK workers and work with both in-house OH teams and OH providers. You can find out more at orchidlive.com.